The outgoing Czech government has declared a nationwide state of emergency to slow down the spread of COVID-19 infections. It took effect at midnight and will last for 30 days. Restaurants, bars and nightclubs will have to close at 10 p.m. The public consumption of alcohol will be prohibited and on-site consumption of food will be banned in shopping centres. Hours after these measures were announced, the country's president, Milos Zeman, was taken to hospital after testing positive for the coronavirus. Portugal is also reintroducing tighter pandemic restrictions, less than 2 months after scraping most of them when the goal of vaccinating 86% of the population against COVID-19 was reached. From December 1st, wearing a face mask in indoor public spaces will be mandatory, and visitors to care homes and hospitals will have to show a negative test. A slow vaccine uptake among pregnant women is raising concern. Scientists are trying to reassure women the jab will not harm their baby, while pressing the virus could be very harmful for them.
If you are admitted to hospital with symptoms of COVID in pregnancy, we know that about 1 in 10 women will need intensive care, and we know that about 1 in 5 women will have a preterm baby. So it's really important that we recognise that the potential big impact on your baby is actually for the baby being born preterm.
The European Medicines Agency has approved the use of Pfizer vaccine for children between the age of 5 and 11 years old.
As Germany reported yet another record number of new cases on Friday, more than 76,000 in the last 24 hours and another 357 deaths, caretaker Health Minister Jens Spahn couldn't reiterate enough the severity of the situation right now. Together with the president of Germany's Public Health Institute, the Robert Koch Institute, Spahn pleaded with the public to reduce contact with others as much as possible, even the vaccinated and those who have already received their booster shots. But any concrete talk of potential wide-reaching lockdowns here in Germany was avoided. At the same time, while thanking Germany's vaccination committee for their work, he did criticise the long-winded process to recommend vaccines over previous months, which has arguably stalled the rollout here in Germany. He said such decisions need to be taken over politically. With that in mind, he also criticised what he perceives to be the differences in attitude towards the pandemic between the outgoing and incoming government, arguing that the incoming government isn't grasping what needs to be done in the short term. So just a couple of weeks from now, it won't be Jens Spahn at that table addressing the media, but a new health minister. And the fear here is that without drastic action, the situation here in Germany might not be the same by then, but even worse in the weeks leading up to Christmas. Kate Brady, Euronews, Berlin.